Welcome to part 2 of our Antepartum assessment series. In this video, we'll explore 4 key tests that dive deeper into fetal health: cell-free DNA screening, cfDNA/NIPT, Nuchal Translucency, NT, screening, Chorionic Villus Sampling, CVS, and Amniocentesis. We'll break down the purpose, timing, procedures, and clinical interpretation of each, plus how to distinguish screening tools from diagnostic tests. If you're preparing for OB nursing, NCLEX, or just want to strengthen your prenatal assessment skills, this is the one to watch. Let's get started. Amniocentesis is a diagnostic procedure where amniotic fluid is sampled to evaluate fetal genetics, infection, and maturity. It's typically done in the 2nd or 3rd trimester, depending on the purpose. When done between 15 and 20 weeks, amniocentesis checks for chromosomal and neural tube defects. Later in pregnancy, it can assess for lung maturity, fetal infection, or complications from Rh incompatibility. Using ultrasound for guidance, the provider inserts a needle through the abdominal wall and into the uterus, withdrawing a small sample of amniotic fluid. The fluid contains fetal cells and substances used for testing. Amniocentesis can detect conditions like Down syndrome, spina bifida, and fetal infections. It also helps determine lung maturity by measuring substances like the lecithin/sphingomyelin ratio or presence of phosphatidylglycerol. Amniocentesis can detect genetic abnormalities, neural tube defects, and fetal infections. It's often performed after an abnormal maternal serum alpha-fetoprotein test, also known as MSAF. It's important to remember that MSAF is a screening tool, not diagnostic. Amniocentesis is the confirmatory test used when screening suggests something may be wrong. This distinction is frequently tested on exams. While relatively safe, amniocentesis carries a low risk of miscarriage, especially if done early. Other risks include amniotic fluid leakage, infection, and Rh sensitization, so Rh-negative patients must receive Rho-D immune globulin afterward. The nurse provides emotional support, assists with positioning, and monitors fetal heart rate and maternal vital signs afterward. Patients are taught to report any leakage, bleeding, fever, or reduced fetal movement. Cell-free DNA screening, often called cfDNA or non-invasive prenatal testing, NIPT, is a non-invasive screening tool that analyzes fragments of fetal DNA circulating in maternal blood. It helps assess the risk of certain chromosomal abnormalities, including trisomy 21 or Down syndrome, trisomy 18, and trisomy 13. cfDNA screening is primarily used to identify pregnancies at increased risk for chromosomal abnormalities. In some cases, it may also be used to detect fetal sex or Rh factor, depending on the lab and provider. Because of its accuracy, it often helps patients avoid invasive tests like amniocentesis if results are low risk. cfDNA screening is done through a simple maternal blood draw, starting as early as 10 weeks gestation. Since it requires no contact with the fetus or uterus, it poses no physical risk to the baby. Results are reported as low risk or high risk for specific conditions. It's essential to note that cfDNA is a screening test, not diagnostic. If results are high risk, diagnostic confirmation is required through Chorionic Villus Sampling or CVS or amniocentesis. cfDNA screening is highly accurate for trisomy 21 and is valued for being both early and safe. However, it's not a replacement for diagnostic testing and doesn't screen for all birth defects. It's commonly offered to high-risk pregnancies, but may also be available to others by choice. Nuchal Translucency screening or NT screening is a first trimester ultrasound assessment used to evaluate the risk of certain chromosomal conditions. It measures the fluid-filled space at the back of the fetal neck, which can be an early marker for abnormalities like trisomy 21, trisomy 18, and trisomy 13. NT screening helps identify pregnancies at increased risk for chromosomal conditions and physical issues such as cardiac defects. It's most effective when combined with first trimester serum screening, which includes pregnancy-associated plasma protein A or PAP-A, and human chorionic gonadotropin or HCG for better predictive value. NT screening is performed via transabdominal ultrasound between 11 weeks and 13 weeks, 6 days of gestation. It involves measuring the thickness of the nuchal fold, or fluid space, at the back of the fetal neck. The measurement is then evaluated in combination with maternal age and potentially serum markers for risk assessment. An increased NT measurement may indicate a higher risk for conditions such as Down syndrome or heart defects. However, NT is a screening test, not a diagnosis. High-risk results are typically followed by more specific tests, such as cfDNA screening, Chorionic Villus Sampling or CVS, or amniocentesis. NT screening is a safe, early option for identifying at-risk pregnancies. However, it is highly operator-dependent, and its accuracy can vary. It's most useful as part of a combined first trimester screen to help patients decide whether to pursue further testing. Chorionic Villus Sampling, or CVS, is an early diagnostic test that collects a small sample of placental tissue to assess for genetic and chromosomal conditions in the fetus. It's one of the first diagnostic options available in pregnancy. CVS is typically performed between 10 and 13 weeks of pregnancy, which allows families to receive early results and make timely decisions when there's a risk of genetic abnormalities. The procedure uses ultrasound guidance to collect chorionic villi, tiny placental projections that carry the baby's genetic material. The sample can be taken through a thin catheter via the cervix or with a needle through the abdominal wall, depending on the location of the placenta. If the transabdominal approach is used, a full bladder is required to help lift the uterus into view. This bladder prep is an important procedural detail that often appears on exams and helps differentiate CVS from amniocentesis. CVS helps detect conditions like trisomies and inherited genetic disorders, but it does not test for neural tube defects, which require amniocentesis and alpha-fetoprotein analysis later in pregnancy. Although generally safe, CVS has a slightly higher miscarriage risk than amniocentesis. There's also a chance of infection, cramping, and Rh sensitization, which is why Rh-negative patients should receive Rho-D immune globulin afterward. Nurses are key in preparing patients, explaining the risks, and offering reassurance. Post-procedure, nurses monitor for bleeding or cramping and ensure Rho-D immune globulin is administered when indicated. Like and subscribe to RN Toolkit for more videos like this.